Communication and Health Services Administration, presented by Julia Trimble. The Health Services Administration field is one that needs to be able to communicate at different levels. They are required to be able to communicate to patients, supervisors, and peers. They need to have both a medical and business vocabulary. Healthcare administrators must learn how to communicate in a variety of communication styles, not only with those within the medical facility, but also to communicate effectively with patients to ensure a satisfying experience within the facility that provides a healing and hopeful environment. In the United States, healthcare administration did not become a separate field until the 1960s. The concept quickly spread globally from the United States to Europe and even to India. Healthcare administration does not spend much time in the visible eye of patients, but is often behind the scenes with a list of responsibilities and an around-the-clock job. Keeping up with new technologies and expanding channels of communication such as email and electronic health records continues to challenge healthcare administrators. Many of the duties healthcare administrators have involve communicating with one person or another. They have to be able to speak to the team members and patients without using medical terminology, but also without making them feel ignorant or talking down to them. In general, administrators enforce healthcare law within a facility, implement regulations, keep up with evolving technology, and implement that within the office, as well as planning, directing, and coordinating healthcare services. Healthcare administrators literally run the business end of the medical field. All healthcare administrators work within a medical facility, but only 40% work in a hospital. Other work environments include smaller offices such as pediatrics, optometry, or dermatology offices. Some administrators manage whole facilities, while others manage departments in coordination with other administrators to manage a larger facility, such as a hospital. Healthcare administrators communicate through the use of email, phone, verbal and nonverbal communication, as well as electronic health records and data analysis. They also have to tailor their message according to who it is they are communicating with at the moment. If they're speaking with another administrator or a member of the clinical staff, they're able to use medical terms. It's safest not to assume that someone understands medical terms unless they have a degree to practice medicine. Business professionals communicate in a number of ways. Internally, they would communicate over email for smaller amounts of information. A large amount of information would be better suited for an open meeting to communicate with many employees. This would allow the staff to sit down together and go over the information necessary and allow for feedback in real time. These types of meetings could also be accomplished over a phone conference. Verbal communication skills can be shown in all of the above areas, but nonverbal communication skills are also able to be controlled. Your image, such as the way you dress yourself and personal hygiene, are aspects of nonverbal communication. Also, making eye contact when speaking to someone is very important. This projects confidence and respect in most cultures. I was fortunate enough to interview two healthcare administrators who provided greater detail on communication in the healthcare administration field. First, I spoke to Denise Ryba, a healthcare administrator at a pediatrics office, who stated that the use of technology to communicate is vital in this field. She explained that the use of email and the telephone provide fast communication between colleagues. She also expanded on electronic health records and the ability to ensure quality of care as patients are able to obtain their medical information at home and even send emails to their physician with questions. I then spoke to Dr. Lin, who provided the inside view from an employer's perspective on communication through technology. Dr. Lin is a professor at Baker College. She also has her doctorate degree in health services as well as many other certificates and is an active member in professional organizations. She shared that information is most often communicated between administrators and superiors through data. For this reason, data analysis skills are required as well as the ability to use modern technology. Healthcare administrators are the business managers of a medical facility. They must possess both the ability to understand and improve medical care while also comprehending the complexities of the business world. Communication in this field is vast due to the wide knowledge base of many staff members. Email, phone, data analysis, verbal and nonverbal communication, as well as electronic health records are all used as resources for communication. Healthcare administrators need to be able to communicate the laws, regulations, technology updates, and business data to supervisors and employees. Possessing satisfactory communication skills in this field is a requirement for success.